All right, so our last speaker of this panel is Rohan Radhakrishna. He's the Deputy Director, Chief Equity Officer, and Tribal Liaison for the California Department of Public Health. Rohan has 20 years of global and local experience learning from and working with climate and environmental justice impacted communities. As a Deputy Health Officer, his experience responding to the COVID-19 pandemic, power shutoffs, wildfire smoke, heat emergencies, has solidified his commitment to addressing the overlapping public health crises of climate change and structural racism. He is a family physician, a public health practitioner, and a past fellow of the California Healthcare Foundation. Rohan represents the Health and Human Services Agency on the Strategic Growth Council and the Integrated Climate Adaptation and Resiliency Program Technical Advisory Committee, striving to embed climate health and equity into all policies. So I will turn it over to Rohan. I think he's going to be with us virtually.
Thank you so much, Dave, and to all the panelists. I'm really excited to be joining this conversation. Humans coming last, part of the problem and also part of the solution and motivation for change. So excited to be with you. My main message is that climate change is harming people's health now, and we have a short window to slow and prevent even worse impacts. Every 1/10 of a degree of warming we prevent means reduced suffering and lives saved. And with climate change being a threat multiplier that can deepen existing inequities, it's also a huge opportunity to improve health, because many of those actions to address climate change also improve health inequity. My talk today will be a high-level overview of connections between climate change and human health, and also set the stage for upcoming webinars that are part of OEHHA's Climate Indicator series. In May, you'll hear more from our head of infectious diseases branch, Duke, who will take a deeper dive into the climate-related impacts of infectious diseases. And in August, you'll hear from our colleagues from OEHHA, as well as the Department of Public Health, on the impacts more specifically regarding extreme heat, wildfire smoke, and other non-infectious stressors. I'm very grateful to the dozens of climate and health staff in our department involved in this work, many in the room today and also online, and spread throughout several centers, offices, and branches, ranging from occupational health to environmental health investigations. Next slide. So the United Nations Secretary General has called climate change a code red for humanity, necessitating urgent society-wide action. And I'm here to represent the code blue for humanity. You heard earlier from Caitlin about hypoxia in the ocean, and it is choking our breathing as a species on this planet. In March of last year, the IPCC issued its synthesis report talking about the threat to human well-being and the health of the planet, and that it's not too late for action. And more recently, in November, weeks before the COP28, The Lancet, a global publication, produced the 2023 Global Report of the Lancet Countdown. And their top-line messages on the links between health and climate are that inaction is costing lives and livelihoods today. Projections reveal future dangers. We are not moving in the right direction as fast as possible. And transformative opportunities for a healthy, prosperous future for all do exist. On the domestic front, we have the 5th National Climate Assessment, and Chapter 15, dedicated to human health, lays out some of the top research findings, including that climate change is harming human health now, from the physical and mental to the spiritual and community health and well-being aspects. The frequency and intensity of these stressors on our environment are impacting our health now. This also includes impacts on food as well as water quality and security. Another major finding was that systemic racism and discrimination exacerbate the climate impacts on human health. And finally, timely, effective, and culturally appropriate adaptation and mitigation actions can further protect human health. At the COP28, there was actually a day dedicated to health, and there was high-level recognition that climate change harms human health, with the unveiling of the COP28 Declaration of Climate and Health that over 140 different countries signed. So here in California, our governor is dedicated to the climate crisis as a top priority, and we can also name it as a health crisis, in fact, the greatest of this century. Next slide. We could easily spend an hour talking about any of the colors here and the impacts on human health. Our team added the pink circle of the mental health impacts, which was alluded to by Madeline, and we'll go through some of these briefly. Let's just start in the bottom right with light blue in terms of severe weather. And you heard from the Secretary this morning about the economic impacts, but think about the massive impact on so many Americans. 78% of households reported experiencing extreme weather events in the past 5 years, and 24% faced serious health problems as a result of it. Between 20 and 65% of survivors of extreme weather events experience mental health impacts following the event. If we take another color like extreme heat, I'll spend more time talking about it as the greatest current impact on health in California, air pollution as well, with our collaboration with the Air Resources Board. And one that often isn't considered in light purple is the impact of migration, certainly on species, but as well as humans. We will see sooner global pandemics due to the crossing of boundaries of humans as well as other species, leading to spread of diseases, as well as impact of humans migrating. Now, we can see this with many conditions like I'll talk about, such as valley fever, spreading beyond that of the valley to more coastal areas, but also the simple migration of humans. So in the United States, in 2022, there were more than 3 million Americans who lost their homes to climate disasters, impacting our existing housing crisis. And since 2017 in California, we've lost more than 30,000 homes to wildfires. You heard this morning from tribal chairpersons and elders from the Lake County region and that impact. Many face difficult decisions about whether to remain or stay or move, and climate impacts can face higher insurance rates, people being dropped by their insurers, and higher housing costs, pushing people through internal displacement. The Camp Fire alone destroyed 19,000 buildings, and we faced climate refugees having to migrate to the Chico area, some of whom remain unhoused and displaced. Wildfire risk across the country and in much of the rest will threaten about 80 million homes by the year 2050. And we know that the impact, even in Central America, from drought to severe weather and the impact on crops, making certain areas unlivable, will force the migrations of humans towards the California border, like has and will continue to happen, impacting California's health in a broad sense. The next slide gives an overview of these types of CDs or diseases. And historically, humans died from communicable diseases, but with innovations in water sanitation and vaccines, we've been able to lengthen our life expectancy to only to die more from chronic disease, the classic textbook epidemiological transition. Well, the third and newest CD on the scene is climate-related diseases that is a threat multiplier of the communicable as well as the chronic diseases, increasing the severity, intensity, and the interactions between these. The next slide talks about chronic disease being the most common, costly, and preventable of all health problems. And as a family physician for over a decade in the Richmond-San Pablo area of Contra Costa County, this is something that I saw every day, how the environment both causes and worsens chronic disease. We can think of impacts on the cardiovascular, metabolic system like diabetes, respiratory system, mental illness. It was referenced the impact of air quality on Alzheimer's and the brain, even the impact of temperature on medications and thermoregulations, common medicines like blood pressure medicines, and mental health or psychiatric medications can be worsened by extreme heat. We know that an increase in ground level temperature can impact ozone and worsen respiratory conditions like asthma and chronic obstructive pulmonary disease. The links go on, not to mention the increase on pollen counts and allergies that affect many across the state. We can have worsening food insecurity that can affect chronic disease and impact those affected by poverty, racism, and gender discrimination even more. The next slide is just a glimpse into the impact from infectious diseases, which will furtherly be discussed in May. But I'll briefly mention, besides water stagnation that can increase Legionella conditions from waterborne pathogens, you also see the impact on mosquito-borne diseases. Studies show higher temperatures increase the viral load from mosquitoes, increase reproductive activity in mosquitoes, and also shortens their incubation period, all of which increase transmission rates. We're concerned in California about the increase in distribution as well as the abundance of the invasive Aedes species, which can be a carrier of dengue, Zika, or yellow fever virus. Also of the Culex mosquito that can transmit West Nile virus. And already last year, we had 2 documented cases of locally acquired endemic dengue in Southern California. I also mentioned, as seen on the right, coccidiomycosis or valley fever. We're going to have to drop the valley from it as it spreads to more coastal regions. This is a fungus naturally found in dirt and soil, initially in Central California, but it's increasing. The spore inhalation can affect lungs. I'm not with you today because me and my family have COVID currently, and it's hard to distinguish COVID from valley fever with similar symptoms of cough, fever, fatigue, and tiredness. And so you heard from Mike, our state climatologist, about drought being whiplashed with heavy rains in the atmospheric rivers. Those are the very conditions in which this fungus can spread and thrive and impact humans, as just one implications of extreme weather. The next slide talks about the mental health impacts that Madeline briefly mentioned. And so beyond the physical impacts that are more noticeable, the psychological impacts are persistent. This can be from loss of income and place, as well as direct impacts on depression, stress, anxiety, grief, substance use, violence, post-traumatic stress disorder, and feelings of helplessness and hopelessness. Research from California specifically showed that higher temperatures increase emergency department visits for mental health outcomes, homicide, suicide, with disproportionate impacts on females, Hispanics, and children aged 6 to 18. Climate anxiety can be defined as a chronic fear of environmental doom, ranging from mild stress to clinical disorders like depression, anxiety, PTSD, and suicide. And the largest international survey conducted recently showed that climate anxiety in youth referenced about 60% of respondents, more than 10,000 across 10 countries, being very worried or extremely worried about climate change. And 45% said that their feelings are impacting their daily lives. This is happening now, and we're actually funding research within California to have the largest nationwide representative sample of the impact of climate anxiety through the California Health Interview Survey. The next slide shows the economic impact that the Secretary mentioned earlier, and we can see a rising price tag year after year. Dr. Field's comments this morning talked about the compounding and cascading impact of the sequence of events that takes a cumulative toll on the human body and psyche. So how do climate-related costs add up? Let's start with premature death. To assign value to the economic risk of premature death, the federal government applies a metric called the value of a statistical life. The economic burden of early death is typically the major driver of costs in climate and health assessments, but just the beginning. Add to that medical care for treatment of physical and mental health conditions, directly and indirectly, in ERs, clinics, and hospitals. Then we note that the California's fourth climate change assessment noted the loss of life from killer heat waves could add up to more than 11,000 premature deaths in 2050 in California, annually having a price tag of $50 billion. Our recent climate and health economist that we hired on our team calculates that damages from climate mortality in California alone could be $280 billion by the year 2040. You add to that the impact on home health, rehabilitation from injury, medications, lost wages, impact on productivity, and downstream health costs like delayed care and homelessness, and you get a rising price tag, and we can really see the value of prevention as well as adaptation and resiliency. So higher temperatures have been associated with more workplace injuries in California, particularly amongst lower income young males, as well as an impact on the perinatal population, with extreme heat leading to an increase in stillbirths as well as premature births. The next slide shows what we heard from some of our tribal leaders this morning about the importance of not just tribal ecological knowledge, but a whole shift in our perspective about our deep interconnectedness. And it's a nice way to summarize all 5 of the presentations on this panel by taking a One Health approach. As the tribal elder said this morning, the impact of a wasp affects our elders, the oak trees. And similarly, Dr. Fields called for a broad, durable coalition. Well, the One Health model talks about the impacts of animals, plants, as well as humans. And when we protect one, we protect all. So please reach out to our veterinarian that we hired in the Department of Public Health, Dr. Kim Conway, leading our new office of One Health that really centers this interconnected approach. This has a lot of action opportunities and coalition building at the global, national, as well as state and local level. The next slide shares some of our most recent science that our department put out just this past fall and shows the analysis from the killer 10-day record-breaking heat wave across Labor Day from September of 2022. We saw a 5% increase in deaths across the state, more than 400 of what would have been otherwise expected for a similar time period. And we know it's largely an undercount when we look at emergency department visits and our disease classifications and electronic health records that we're constantly trying to improve. But an important note from this research is it wasn't just older adults that were impacted. In fact, the disproportionate impact of this most recent killer heat wave in California was seen amongst working age adults, age 25 to 64, amongst Latinos, and amongst people from the South Coast or Los Angeles region, potentially areas that may be less acclimatized and not have access to cooling. So yes, we want to plan for older adults because we can also get co-benefits for people with disabilities and those who are linguistically isolated or have chronic conditions, but we need to follow as close as possible the real-time science of who's disproportionately impacted so it can inform our statewide adaptation and resiliency plans. We have so much action that we're doing as a department to get the word out to local departments, counties, service providers, health departments, schools, sports, and others to stay safe amongst the impact of extreme heat. The next slide shows how we know that amongst all humans, some communities are hit first and worst, which is what we saw during COVID. And the next slide shows how this notion of not being able to breathe, hypoxia was mentioned earlier, is something that has racial equity implications from the struggle for Black lives, with the impact of COVID affecting some communities more, and also with that call to action for a code blue for humanity, that we need to address the impact of structural racism. It's not a coincidence where highways were built, where home loans were denied, where factories are zoned, or where asthma rates and climate impacts have a higher burden. The next slide is really the most important, that tells you that a health frame is now the most motivating frame for the average American. So as we try to move the movable middle and mobilize a broad and durable coalition, like Dr. Field talked about, in particular recommendation 2.1 from his report, note that 76% of Americans, according to Eco America, are motivated by health for climate solutions. For the first time ever, more so than jobs. And trusted health professionals are valued by average Americans. You can see members of Congress and car salespeople in the bottom part of the graph on the right, and health professionals on the top side of the right. So really centering health and well-being of all people and taking that One Health approach across generations can be a powerful driver for action. Our final slides tell a little bit about what we do within our department. We take a climate, health, and equity in alls approach to all policy by supporting a variety of agencies across the administration. Next slide shows that specifically we'll be building out a near real-time notification system for syndromic surveillance. Michael talked about estimating and modeling snowpack. Caitlin talked about modeling sea level rise. We aim for more real-time estimates of the climate-sensitive health impacts by leveraging data systems from our emergency departments and health records across the state. The next slide shows how we have a variety of toolkits and visualization tools. Just like EnviroScreens, we have one specific to more health indicators, and we issue county-level climate and health profile reports, as well as advising local health departments. And the next slide shows how we partner with the Air Resources Board for the Public Health Work Group to go deeper on a variety of these topics, whether it's protecting worker health or talking about the mental health impacts in California. The final slide shows a nice case study of an example of adaptation and resiliency. And this relates to what our morning speaker, Robin Wilson, talked about those win-win resiliency examples, which is building for a better future. Our pilot in Tulare County with promotoras and community health workers to weatherize low income and to promote energy efficiency homes is a great example of that triple benefit of lower energy costs, lower emissions and air pollution, and better health overall. So this is that multi-benefit model that we really like to promote. I'll end by saying that the health sector is a major reason for building a broader coalition, that we're also part of the problem. We create 8 to 12% of emissions when you include our supply chain. So we're really a key player for mitigation, adaptation, and resiliency. And that one health approach can really promote the health of all people, including future generations. So thank you for this opportunity to join the panel, and look forward to engagement through the questions.
Great. Thank you, Rohan. So we have a few minutes for questions for the panelists. Just wanted to say thank you again for coming today. These were great talks to really set up how the indicators play a role in California policy in many different sectors. Really just want to highlight the great work that all of you are doing, and also the use of technology to bring accessibility and data transparency to all the work that you're doing. So really excited to see all that work. So with that, I think we have some time for some questions in the room. Someone wants to have a microphone?
On? Is it on? Okay, I'm going to try and read this before my laptop dies. And this is for you, Madeline. First, I wanted to echo all the presentations or panel discussion I thought was very interesting. Specifically to the 30 by 30, I was really interested when you were showing the map of the different biodiversity areas around the globe. I was wondering if you could discuss the relationship between biodiversity conservation and the local economy, and in areas where it may be very expensive, is there an issue of is preservation less obtainable? Or in developing nations, is there pushback on folks who are saying that it might limit their growth? And if there is, are there conflicting priorities that seem to sway the level of implementation?
Great questions, and yes, then there's a lot to that, right? So yes, conservation is more expensive in a variety of places, and I know our last speaker touched on it, but one way that we're really trying to maximize what we can get for conservation is looking for those multi-benefit opportunities. So where can you find biodiversity, climate, access, public health, all the things, right? And so I think that's what's driving a lot of that prioritization, is where can we get the most bang for our buck, and some of that is expensive. And on the global scale, if we're all committing to 30%, we're all committing to that same goal, right? And we do have meetings. So California is part of a High Ambition Coalition subnational task force, because we are our own country to be a signatory to that biodiversity framework, but a group of subnationals from all over the world have come together to say, how can we learn from each other? Because each country might define what conservation is differently. And so how can we learn from each other? How can we grow on that? And so I think we're all learning together, we're all growing together, and it is very complex. So as we continue to sort out, where's the expensive, how can we make sure everybody's brought along, how can we, I know a lot of our European partners they aren't dealing with the same tribal issues we are. And so it's very interesting to have conversations with them and kind of talk through our things, and we're hearing different perspectives all the time. So a lot of growth needed to happen, and those things are definitely on our mind, and how we message and making sure it's not a land grab or anything like that, and really prioritizing the fact that we need nature for food too, right? We need nature for solar is one of our priorities, and so there are many conflicting priorities, and so solid planning is key.